Good morning, everybody, and welcome back to your Lunch Break Live. I'm your host, Savannah Tryens-Fernandes, and today is, I almost said Tuesday. Today is Wednesday, January the 5th. And today we're going to talk about a story that was published on AL.com just before the holidays. So some of you may have missed it. You might have already been in the holiday mode. Today I am joined by the reporter who wrote that story. This is our Alabama Education Lab reporter, Savannah Tryens-Fernandes. Now, Savannah wrote this story. Again, we're going to link it here in the comments so you can kind of give it a look as we're talking about it. And this story was about how routine childhood vaccination rates in Alabama have dropped during the pandemic. Some of these vaccination rates have dropped up to 50% for certain vaccines. Now, this again is statewide, and these rates are concerning all kinds of vaccines, including those for polio, mumps, chickenpox, the flu, tetanus, measles, hepatitis, and whooping cough. I had to look down and make sure I got some of those because those are the routine vaccines that many of us don't even think about. They just are the ones you know you need when you go to school. So again, Savannah wrote this story about how many of these rates have dropped since the pandemic at pretty astonishing numbers. So Savannah, I know that this was something you wrote a couple weeks ago, but I thought it was worth talking about, especially because of the news we've seen lately about COVID and Omicron and all of these COVID rates coming up. And many doctors say that's due to low vaccine rates. I know we're not talking about COVID vaccine today. We're talking about other vaccines, again, in kids. But it is worth kind of tying them together with what some of these doctors have to say.
Yeah. I mean, if we're seeing very low rates for childhood COVID vaccination in the state, and now we're just seeing further decreasing rates for those diseases that you mentioned. So we're just in a public health kind of moment here for children that's very concerning.
Mm-hmm. And we're gonna get into some of these details, but I'm gonna quickly address something that one of our viewers, Julie, said. She said people are starting to question everything since the COVID vaccine. And Julie, that's actually what some of these doctors that Savannah spoke with said. I actually think I have a quote here in my notes by a doctor said that parents who never doubted vaccines before are now starting to question them. So that's a good point, Julie. And unfortunately, that's what these doctors and public health professionals are saying. So Savannah, let's get into some of this data, and then we'll get into, again, some of the broader picture here. Some of the data, I know you got that from the Alabama Department of Public Health, but tell us exactly what that data shows and what that time frame was.
Yeah, so we looked at data from 2018 to 2021. So these pandemic years, a bit before the pandemic and during the pandemic, to see how rates for vaccines, 16 vaccines, the ones you mentioned, chickenpox, tetanus, the flu, have gone down in that time frame. So from 2019 to 2021, we've seen that overall, the rates have gone down by 26% in the state. Each vaccine, though, is a little bit different. So hepatitis A, for example, has gone down by 50%. The chickenpox has gone down by 30%. So there's a bit of a range, but 26% overall is a pretty large portion of children in the state.
And that's a good thing to mention because you talk about how about 26% vaccine rates down overall across the state. But these vaccine rates have a little bit of a difference when it concerns a specific vaccine. Now, I think that's interesting because it seems like a lot of us pre-pandemic just got those vaccines kind of in a batch. You knew you needed, say, 5 or 6 vaccines. Parents would take their children, or teenagers, if they were going to high school and had to get them themselves, would go to the pharmacy or to their doctor and just give them the list or say, I need XYZ vaccine. We didn't see, at least statewide, we didn't see people generally picking and choosing those vaccines that they got as much as it seems like they're doing right now.
Yeah, well, so some of those vaccines are required for school. Not all of them are, but a lot of them are. But what's happening is with less in-person learning, without any enforcement at the school level, those vaccines are trickling down. Those numbers are trickling down. So the ones that are required for school are not falling as far as ones that aren't required for school, but we're starting to see those go down at rates that we hadn't seen before because of, a turn to remote learning, people not being able to access preventative health care during the pandemic, and just a lot more hesitancy, as you mentioned at the beginning.
Now, something that also I think is interesting here is let's look historically, and that is where Alabama had been actually one of the leaders nationwide in these vaccine rates. So that's a drastic change in Alabama being one of the most vaccinated states against many of these common these common diseases that are preventable, right? I think that's fair to say. We had been among the top states doing that. And now, again, those rates are falling as we see Alabama being, I believe Dr. Scott Harris said yesterday, 45th in the nation for COVID vaccines. We're seeing a direct correlation with other vaccines rates falling. So that's an interesting thing to note as well. Now, Savannah, you mentioned school. So I want to talk a little bit about that. And again, you are part of our Alabama Education Lab where you focus on schools and kids in the school age bracket. So these vaccines, most of us know, are required, or at least most of the vaccines are required to go to school. But you have a line in your story, and I want to get it right. So I'm looking down here to find the exact way that you worded it. But you said in your story that there are no mechanisms at the state level to enforce kids getting these vaccines that are supposedly required for schools. So what's the point of a requirement if you're not going to enforce it?
Yeah, well, I think it's what you said, how historically we've had these very high vaccination numbers. I mean, as recently as 2017, it was about 95%. Going back even further, you hit 99%. It was just kind of taken for granted that people would get these vaccinations. And now, we can't do that anymore. Nearly 7% of kindergartners weren't up to date on their vaccines. But, if you don't have your certificate of immunization card up to date, the school can't say, well, you can't come to school, or they can't pull you out of the classroom. So we're kind of battling what we've known in the past for what the kind of present moment is showing us.
So I think that most people would believe that those requirements, again, you mentioned that immunization card, I think the blue card we called it when I was in school. It's probably a different color now, but those cards were a requirement. You had to get them filled out, turn them into the front office or into somebody in administration at the school to register or to attend your first day. So if you just don't turn that in, I think that most people probably believe that means you can't go to school, right? But it sounds like what you're saying is it's more of an expectation, but there's not really any consequences if you don't do that.
Yeah, exactly. I mean, we spoke to Alabama State Department of Education, and they said, we are bringing parents into a nurse's office to try and reinforce how important it is to get vaccinated. We're pulling them out of carpool lines to say, hey, your child is not up to date. Can you get them XYZ vaccination? But at the end of the day, they're still allowed in the classroom. They're still allowed in school.
So tell us why. Why are they still allowed in school, even if the school nurses, the teachers, and the administration are doing everything they can to communicate with parents what needs to happen? Why are the kids allowed to go back into the classroom?
Well, according to the Alabama State Department of Education, they believe that every child is entitled to a free and fair education, which is federal law. But they believe that requiring vaccination is counter to that federal law.
Is that something that has become the belief because of COVID vaccinations, or was that the belief prior to coronavirus?
I believe it was prior, since it's never been a requirement they've had in place. But we know neighboring states like Mississippi require students to have a vaccination card.
And you say that when they require, is it the same type of requirement as Alabama where they can require but not enforce, or do they actually enforce it?
There's enforcement in other states.
So it seems like this is a state level problem. This is not a federal problem.
State level problem that they're using the federal law to kind of shield themselves from.
That's very interesting because, again, I think most people see the word requirement and they just believe that attached to a requirement is a consequence if you do not fulfill that requirement. That's kind of one of those, just when you see that word, that's what you think of when you see it. Now, I want to remind anybody watching, if you have questions about this topic, feel free to leave them here in the comments. I'm trying to scan through them and see, make sure I don't miss any and make sure that we answer your questions. Now, again, we have some people talking about what you just mentioned, Savannah, about how Mississippi does enforce those requirements. Again, Alabama saying they can't. You had another interesting line in the story about enforcement. You said that AL.com could not find any local agency that actually put measures into place, even though Alabama says local school districts are in charge. So technically, could a local district make that decision, since the State Department of Education kind of prides itself on leaving these decisions up to the local schools?
Yeah, they could. And that's kind of that tricky balance, right? Where they say, hey, federal law prevents this, but local school districts can also put these mechanisms into place should they decide to. So local school districts can. We just haven't been able to identify any local school districts that do.
Do you think that most parents would be surprised to learn this about their kids and their schools, Savannah, or do you think that most parents already know that this is happening?
I'm really not sure. I mean, in reporting this story, I was surprised to learn that there's no enforcement mechanism in place. Schools are a very closed environment where you have a lot of people in one setting. And so if one person is not vaccinated against mumps, measles, something that's been eradicated for so many years, and brings it into a congregate setting, then that poses a danger for everyone.
I want to go over a couple of kind of just quick facts you mentioned in your story that I've got written down here. And you mentioned this a minute ago, but I think it's worth repeating. Nearly 7% of kindergartners in the time period that you looked at this data are not up to date on these routine vaccines. That's over 3,500 kids. Again, some of these vaccines include vaccines like for polio, for chickenpox, tetanus, the measles, the mumps, hepatitis, whooping cough, and flu. So these are, again, those routine vaccines. We are not talking about the COVID-19 vaccine here. That is not part of this conversation or this data. So I just wanted to make sure we note that. But those other routine vaccines, nearly 7% of kindergartners in the state are not up to date on. And that's a pretty sizable number, over 3,500 kids. Now, again, something you mentioned in the story that I think bears repeating is while we can't necessarily tie any outbreaks to schools, it's a little tricky to do that when it comes to the tracking here. There has been a hepatitis A outbreak in the state over the past several years. We don't have data to directly say it started in a school, but that is just something to keep in mind, right? That Hep A has been spreading throughout the state at a rate that we haven't seen as much. And then you look at Hep A being one of the vaccines where the rates have dropped dramatically since 2019.
Yeah. And there have been over 1,600 cases of Hep A over just the past year, mostly among adult men. But I mean, still, if something is if something is spreading and there are people that aren't vaccinated against it, it becomes a threat to those who aren't vaccinated. And I think that's just something to keep in mind here with these vaccines. Unlike COVID, we're not going to be sick always immediately. So, for example, HPV is one of the vaccines that went down by 20%. In 15 years, are we going to be having higher rates of cervical cancer among women? Because they're not as vaccinated, we just don't know that yet. But when you aren't vaccinated, you just make yourself a lot more vulnerable to these diseases.
That's a good point about the HPV vaccine. I didn't mention that one. Down 20% from the years 2019 through the data in 2021. That's a big percentage here. That's what, 1/5 of the population who was accounted for in this data. 20% is a big number. Now, a question here from Ed, and I think this is a good question. And he says, can Alabama pass legislation, I'm assuming regarding the enforcement of the required vaccines?
So the only legislation that's been pre-filed right now is actually kind of trying to do the opposite. So right now for vaccination, you cannot have a philosophical exemption to be vaccinated. You can have a religious exemption or a medical exemption, but you can't say, because this is a personally held belief, I will not be vaccinated. But right now there is a bill in the legislature saying, people can opt out of vaccinations if it's a deeply held belief of theirs. So we're kind of going in the opposite direction of that.
But do you even, if you're going to be the person that does not want to vaccinate their children against these diseases, do you even have to say you have an exemption if you're just not going to fulfill the requirement? These people that you studied in this data, or the data that you looked at rather, did it say that these people were actually opting out due to different exemptions, or they just weren't giving a reason at all?
Yeah, that's not that we don't have that information. We just had, the numbers, and then went based off of, what doctors and public health officials were telling us, what they were hearing from their patients. But I mean, so far, it seems that people are opting out because, one, not as many people were going to their pediatrician during the pandemic, and two, there's just a lot more hesitancy. Because, states like Mississippi do enforce these in schools, we could say that there's an option for Alabama to do the same if they were to pass legislation, putting that forward, but we're just kind of going the other way.
That's a good point. So somebody in theoretically, a lawmaker could say to the legislature, look, I'm going to put in a bill to say it's time for Alabama to enforce, actually be able to have consequences and pull kids out of school if they don't have these required vaccines. But what you're saying is that it's not happened.
No, and those decisions can be made on a local school level district. Those are where those decisions should be made. That's where people, that's where the authority to make those decisions right now is, but it's just not happening.
Now, I know that you did a lot of deep diving in this and you contacted local agencies to, again, ensure you were reporting that they were not putting those measures in place. Did you get an answer from any of those local districts you contacted about why they weren't pulling kids out of school or why they weren't providing consequences there?
No, the kind of standard line was that, we believe that it wouldn't give students the right to a free and fair education, and we want to have as many students learning in person as possible.
Now, I want to ask you as well what experts said about this. I know that at least one doctor that you spoke with said that she didn't have this problem until the pandemic, when parents actually started having questions about the vaccines, questions which they did not have before coronavirus vaccines became very hot topic. But I know you also spoke with the Alabama Department of Public Health. So what did those experts say?
Yeah, the Alabama Department of Public Health is saying that because people just didn't really have access to their pediatricians during the pandemic, that they're just not going in to get vaccinated as much as they were before. But the pediatricians I spoke to said, I had parents that routinely came in to give their children flu shots, and now those parents are adamantly opposed to just, something that they would do without question before.
What did the Department of Public Health advise? I know you spoke with Dr. Carol Landers from the Alabama Department of Public Health, who has been somebody who has been with the department for years and for decades, but who has become a little bit more of a household name now since the coronavirus and since her work there getting the message out. She's also a pediatrician. So what did she say about this issue happening?
Yeah, well, ADPH is concerned about the drop in numbers, and they are urging parents to make sure that their children are up to date. They've been doing billboard campaigns for HPV. They've been doing social media call outs. They have a whole campaign going on right now about making sure that children are up to date on vaccinations. So it's something that they're putting a lot of attention and focus on. But, at the end of the day, that decision lies with parents.
This is a fascinating story, Savannah, and I think this is something, again, most people didn't know, that required vaccines, requirement is a very loose word here in Alabama, and that many of the kids whom you might believe go to your children's school, you might believe to be vaccinated against these routine vaccines, or receive these routine vaccines, I should say, in their childhood, they might not be getting, and they might still be coming to school. So, Savannah, I know you're going to keep an eye on this. I know you're going to continue to look at the data. This data went through 2019 again to 2021, and we will link that story here so people can read that. And if they have any other questions, again, contact you or the Education Lab. We'll leave all of that information here in the comments. So, Savannah, this is a very interesting topic. I know this is one that gets a lot of people heated. So thank you for coming today, explaining this, and kind of giving us a look at that data.
Yeah, thank you for having me.
Savannah, thanks again. If you want more information about our Education Lab, you can go to, again, the links here in the comments, and we will see you tomorrow.